international health regulations, correct? কোথায় কোথায় where it is applicable? Airport, seaport, land port. In general, points of entry. IHR regulation and what are the main characteristics? What are the main characteristics of international health regulation? যদি 5টা লাইন বলতে বলি কি বলবে? First implemented in the year 2005, crafted by or made by জোরে 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 আমি শুনতে পাচ্ছি না এখানটায় দাঁড়িয়ে। WHO, is that correct? UNICEF. What are the reasons? কেন তৈরি করা হয়েছিল? To prevent an epidemic and prepare mitigation plans to combat if any epidemic happens. How many countries are on it? 134. And what are the major diseases? Some viral, some bacterial, some parasites. হয়ে গেল 5 লাইনের বেশি হলো। একটা যদি শর্ট নোট আসে হোপফুলি লিখতে পারবে, আলতু ফালতু জিনিস না লিখে। So again one of the newer topics that in this decade are becoming much more important than the previous infectious diseases, that are antimicrobial resistance or AMR. Just to ask, what is the difference between antimicrobials and antibiotics? Antibiotic is for bacteria. So all antibiotics are antimicrobials, but all antimicrobials are not antibiotics. That is why we are not concerned about only antibiotic resistance. We are concerned about antimicrobial resistance. Okay, that part you know. Now, what are the reasons we are now that much concerned about AMR? In our India, we do not have that much documented cost documented due to AMR, but for US it is available. So what is the burden, global burden? That 1.27 million direct deaths due to bacterial antimicrobial resistance till 2019. That means before COVID. Again, what are the deaths associated? That is 4.95. Reason and associated are different. What means associated? That due to presence of AMR, they were given higher and much more toxic antimicrobials. And you all know, if we use meropenem, what is it? Hepatotoxic or nephrotoxic? If normal staphylococcus or if you are talking about MRSA, what is MRSA, sir? Then what is the drug of choice for that? Vancomycin, linezolid. And what is if we are talking about vancomycin, is that hepatotoxic or renal toxic, that nephrotoxic? Suppose it's a nephrotoxic drug, then gradually there are failure of renal functions and the patient dies of renal failure. That is means that means associated with AMR, because the reason we used vancomycin or linezolid due to the presence of MRSA, that means resistance bacteria. And what are the cost? 1 to 4 trillion US dollars. Okay, this is a high cost we have to bear because of the presence of AMR. Okay, now there is obviously a definition when to tell it's a AMR, that it occurs when bacteria, viruses or fungi or parasites no longer respond to antimicrobial medicines, making infections harder or impossible to treat. Simplest definition: any virus, bacteria, fungi or parasites not responding to previous or usual medications, which makes the infections to treat more hard. Okay, nothing else. And obviously antimicrobials, you know, include antibacterial, antifungal, antiparasitics. Okay, now this is some part of your pharmacology, how the AMR or resistance emerges. In our nature, obviously there are some evolved microbes and some normal microbes. Evolved are always less in number. When we use any microbials in insufficient doses, either the doses are less or every antimicrobials have some regime. It has to be consumed at least 5 days, at least 7 days, sometimes 3 days. We call it a course. Okay, this duration is based on multiple researches on the colony of microbes. Okay, that to eradicate all the microbes from the host site, how much dose and how many days it must be given. 2 factors, doses and duration. These are adjusted, again readjusted, and then finally if there are similar results in multiple clinical trials, that dose is fixated. Suppose if we are giving amoxicillin, clavulanic acid combination, what are the usual days? 5 to 7 days at least. If you are giving metronidazole 300, then how many days? 3 to 5. Okay, this duration is based on multiple researches, but if there is problem in drug adherence, that means patients who are not taking their drugs in a regular way. Okay, 3 din newar kotha, he or she is supposed to take it for 3 days, but taking only 2 days because the symptoms disappears. That is a very common practice in general population. But what it makes, the resistant bacteria, this one, yellow ones, they survived. Okay, and then they multiply. Obviously a bacteria will multiply, and by multiplication it causes a reinfection or new infection. Okay, sometimes we call it a super infection. That is the thing we are worried about, that super infections of resistance bacteria where normal antimicrobials or usual antimicrobials are not working. Okay, this is the simplest way how resistance emerges. And what are the ways? You all know that sometimes it produces drug inactivating enzymes. For example is penicillin. For penicillin, bacteria develops which enzyme? Penicillinase. Sometimes it reduced the permeability. Can you tell me which antimicrobial uses the permeability factor? make the microbes porous. Amphotericin for antifungal. There are many examples. Sometimes biofilm formation. Which bacteria usually we see it on the tip of the catheters, either it urinary or sometimes central venous line catheter. What is the commonest bacteria? E. coli, staph, cyanobacter, there are many things, and biofilm is very hard to eradicate or eliminate because this biofilm layer is impermeable to any antimicrobials. Okay, and obviously there is target alteration, that means the usual receptor gets modified. Previously it was a sodium potassium ATPase pump, now it's not working, not exchanging sodium potassium. Okay, and obviously there are efflux pumps. You all heard about it in your pharmacology. Now why there are increasing in AMR? What are our parts we are playing about? One thing we told, that is insufficient doses or sometimes non-compliance from the patient, and obviously the major part, that is over prescription of empirical use. Okay, a simple infection we are using antimicrobial now. We are not giving chance to our natural immune system. Sometimes a patient coming, sir, I have an important meeting tomorrow, but now I have some fever or sore throat, I have to give a speech, please prescribe me an antibiotic. And we do usually. Previously obviously we do. Okay, he is asking for prescription antibiotic, we will give him. We are not giving the normal chance to his own immune system to fight this infection, and it increases the antimicrobial resistance. And obviously self medication and OTC, that means over the counter use of drugs. Now everyone is ChatGPT or at least Google educated. Google, I am having fever, some sore throat, runny nose, what do I do? And Google will answer, go to medicine shop and ask for this, probably you have this. As a cautionary tale, Google will tell at the end of the line that, but please, before buying any antimicrobials, please consult a doctor. But that is the injury to that patient's ego. अरे क्या जानता है वो लोग, अगर जो गूगल जानता है वो भी वही लोग जानता है. But nobody knows that Google does not read Harrison. Okay, they are feeding from, every AI has some input feeding. Right now you know that they are feeding from the marketing apps of different pharmaceuticals. They are getting information from that sources, and from that source they are giving you the information. That is how AI works. You have to give him first information, he will analyze and then he will answer you. Input and output, and that is why there is that is the wrong thing in AI. Okay, and that is why he will prescribe you like this, and obviously I will go and do. And obviously there are wrong dose and incomplete course that I talk about. What are the other reasons? Poor quality or counterfeit drugs. Right now there are too much medicine companies in the market, and obviously to give you at a cheap price they have to cut some corners, and obviously we will choose the cheaper one sometime. একটা অগমেন্টিনের পাতা যদি 500 টাকা দাম হয়, আরো অনেক অ্যামক্সিক্ল্যাপ তুমি পাবে যেগুলোর দাম কম, অবভিয়াসলি আমি সেদিকেই যাব যদি আমার কাজ হয়েছে আগে। কেন টাকাটা কম সেটা নিয়ে ভাবার মতো সময় আবার নেই। and obviously there are sometimes some brand value also. For that we have to give much more higher prices. Okay, and obviously these are the new. I talk about One Health, that means environment health, animal health and our health are related to each other, and usually for some issues some antimicrobials are used in animal husbandry. Okay, estrogen injection is given to cows to increase milk production. Many antimicrobials are given to chicken, okay, as a feed to increase their muscle mass. Okay, so next time you will think about eating a juicy piece of chicken leg, think how this much thick the leg has become. Probably it is due to use of some hormones and sometimes some antimicrobials. Any chemical has some there are other effects. Okay, that is the reason. And obviously we have weak penal code during this, so that if we even catch the culprits, we cannot pursue any legal course against them. These 6 are the reason that AMR is increasing, not how it is developing. What are the reasons behind increase of this AMR cases? Okay. Now One Health I already told. Now there are some common diseases that you all know about. Those are right now showing antimicrobial resistance, and out of these 4 are right now very much important, and our own country has developed a surveillance system regarding 4 pathogens. Okay, what are the commonest? Tuberculosis, we all know about MDR and XDR-TB. Do you know there are the rise of double XDR-TB? Beyond MDR and XDR, XDR means extreme, there is now double XDR-TB. Okay, and if we use this and if it develops this way, there will be much more X. And obviously malaria usually shows a dual type of resistance. Malaria has its vector and its a parasite. So parasite can develop resistance, and obviously the vector mosquito itself can develop resistance against insecticides. Pneumonia and ARI, the most common organism we find resistance. Okay, and most difficult to treat. That is why today intubation is not indicated if not extremely necessary. Okay, because it causes respiratory infection, and it is the most common also organism to create biofilm. That is why it is much harder to treat. Okay, Neisseria gonorrhoeae, previously we treat it with single shot of or courses of penicillin to neki injection, penicillin shot, taito ampicillin taito neki kire baba to blind keno tombra jai hok. But now Neisseria gonorrhoeae is resistance showing against ampicillin or penicillin injection. Okay, obviously dysentery and typhoid. Typhoid is also one organism showing resistance to multiple antibiotics. Okay, so which was previously easily treatable now becomes very difficult, and that is why the safe water filtration is nowadays that much necessary. And obviously foodborne infections. What are the commonest foodborne infections? If we are talking about Chinese food, what is the most common cause of? Bacillus. And if we are talking about rice, then the rice water stool hai. But is the rice যদি আমরা পচা ভাত খাই, what is the reason? What are the pathogens? ওদের সেকেন্ড ইয়ারে ছিল না, লিখতে হতো ল্যাব ডায়াগনোসিস, এখানে একটা কেস দেওয়া হতো। তাহলে চাইনিজ খাবার ছিল যদি ব্যাসিলাস, তিনটে খাবারের জন্য তিনটে কিন্তু সেপারেট। ইফ ইটস মুগলাই কুজিন দেন ডিফারেন্ট প্যাথোজেন, our Bengali or Indian whatever you say different pathogen, and Chinese different pathogen. That was one of the clue to detect the pathogen and to write the correct lab diagnosis. তাই মনে রাখতে পারলে ভালো। Tuberculosis already discussed, malaria now double resistance, you all know. Hospital acquired infection, I will talk about it tomorrow's class. Then community relevance, ARI, pneumonia and child health. You all read about IMNCI. What is the antibiotic given for IMNCI? কি অ্যান্টিবায়োটিক দেওয়া হয় যদি নিউমোনিয়া থাকে? কিভাবে IMNCI ডিটেক্ট করব? কি কি পয়েন্ট দেখব? IMNCI অনুযায়ী নিউমোনিয়া ডিটেক্ট করতে কি কি পয়েন্ট দেখব? What are the points we should monitor about to detect? What are the classifications of pneumonia in IMNCI as per IMNCI? No, some, severe, কি ছিল? পরীক্ষার 2 মাস আগে IMNCI যদি নিজেদের মনে না থাকে এটা কিরকম? IMNCI পড়ানো হয়েছে তো, স্পেসিফিক্যালি কটা দিন আগে পড়ানো হয়েছে। চলো কি স্যার ভ্যাকেন্ট লুক কেন? প্রথম বলছি ওয়ার্ডটা আজকে IMNCI। তো বই খুলেই বসে আছে, কি আছে বার করো তো দেখি, এটা কি বাসটা? কি IMNCI কটা কালার আছে? হ্যাঁ কি কি? Good. And what are the classifications of pneumonia? Obviously there will be a severe and obviously there will be absence. That is we know, that we call no pneumonia. What is the middle? Some or somewhat? হ্যাঁ না, আমি নিউমোনিয়ার বদলে ডিহাইড্রেশন বলে যাচ্ছি তখন থেকে। কোনটা? Obviously there are ways to detect pneumonia. First is respiratory rate. What is the rate of a child less than 1 year old? Normal respiratory rate of a child 1 year old কত? 20, 40, 50, 60 কিছু তো বলো। আর অ্যাডাল্টদের কত? 12 থেকে 18। তাহলে 1 বছরের কম হবে তো নেক্সট নাকি? বেশি হবে। কত বেশি হবে? 30 to 40। আর যদি আরো ছোট হয় 0 to 2 months আরো বেশি হবে। প্লিজ IMNCI-টা নিজের মাথায় ঢুকিয়ে নাও। If possible we will give you a case coming to immunization center. There you have to perform IMNCI in front of us and write and give us the findings and advice. Actually you have to treat the patient, then that we will see, and then you have to tell us. That is the plan. Okay, previously in community medicine there was long case and that long case was always IMNCI. Practical অত ইজি নয়। প্লিজ IMNCI-টা পড়বে। আমি কালকে আবার জিজ্ঞেস করব, আবার কালকেই ক্লাস আছে, সকালবেলায় 9টার সময় আসবো আর জিজ্ঞেস করবো। IMNCI আমি কালকে চাই যেন সবার কাছ থেকে উত্তর আসে। যাক, পেছনে যারা বসে ভাবছো যে দেখেনি স্যার, হ্যাঁ ওইদিকে যেমন একজন যেই পেছনের কথা শুনলো তখন মাথা তুলছে, হ্যাঁ কি বললো স্যার। কালকে স্যার আপনি হচ্ছে গিয়ে সবার আগে IMNCI-এর ফার্স্ট কোশ্চেনটার উত্তর দেবেন। Okay, roll number red শার্টের পেছনে ওই দুজন পর পর, one of the lateral and যে মিডিয়ালে বসে আছো দুজনই, তুমি ওর রোল নাম্বারটা নয় নিজেরটা বলো আগে। হোয়াট ইজ ইউর রোল নাম্বার স্যার? 58 আর তার পাশে 23, ঠিক আছে স্যার, কালকে 23 and 58 ফার্স্ট আমাদের জিজ্ঞেস করব। What are the consequences? Right up to now we see some, what are the reasons of AMR developing, what are the reasons of increasing the rate of AMR. কি হলো silent একটু please. What are the reasons of increase in the AMR cases? Some useful or public health relevant examples, and now what are the consequences. Obviously if there are cases, more cases of AMR, then common infections are getting hard to treat. Then obviously if we have to buy or provide high quality or higher end antimicrobials, there will be increase of cost and obviously longer duration of hospital stay, which also inadvertently will increase the hospital cost. Okay, obviously there will be a cases of some treatment failure, and if there is treatment failure there will be either severe disability, that means you will be permanently on dialysis, or death. For those who are getting on permanent dialysis, death is sometimes much sweeter deal than getting dialysis every 15 days. So first thing we have to prevent it, these AMR cases. Okay, and to prevent AMR, first there was some global action plan, and then by 2005 India first released their first national action plan. Okay, then it got revised in 2011, again in 2013 we introduced national action plan for AMR containment in healthcare. Okay, it got revised in 2017 again, and in 2017 it was up to 2021, but in between COVID happened, so data collection became very much difficult, and now in 2025 there is a new action plan on antimicrobial resistance containment in healthcare. But the major difference in 2025 that this is the first time where we acknowledged the One Health approach. That means to containment of AMR we not only have to contain the healthcare, we have to containment in the environment and animal husbandry system. Okay, so for that we first have to have a surveillance system for data collection obviously, and for a surveillance system to work we have to identify some bacteria for which we are interested about, and for India is right now interested in 4 pathogens. Remember their names: Staph aureus, Streptococcus, Vibrio cholerae, and this gonorrhea. Okay, sorry, E. coli, not gonorrhea, E. coli. Not this, you do not have to follow this table, this is not the reason. The 4 pathogens, that is Staph aureus, Streptococci, Vibrio cholerae and E. coli. These are the 4 pathogens our own government is tracking about their growing resistance and resistance numbers of resistance cases. So for prevention we first have to containment the infection at our healthcare system. That is hospital acquired, that is also included in the hospital acquired infection, which I will discuss tomorrow's class. Okay, but first simpler things, what are the sectors we have to prevent in the healthcare system? Hand hygiene, that is for us, that means healthcare personnel, not only doctors but paramedical staffs, even group D staffs. Then Vaccination. Healthcare personnel also should be vaccinated against common pathogens for which vaccines are available. Okay. Then safe water and sanitation. IPC in hospitals. Okay. If any hospitals are not abiding by this hygiene, they have to be held accountable. Okay. Obviously, these are the things where sometimes hospitals try to cut corners. Low quality phenols, low quality chlorine, they might use. And these are the things they should not. And obviously, food safety. Hospital e je food banano hobe for patients, it should be made in a hygienic manner. And obviously, in practical scenarios, there should be rational use of antibiotics. What case I discussed earlier, this kind of practice should be abolished. And that is why there should be a monitoring for, there is a monitoring for the prescriptions. Okay. What are the cases and what kind of antimicrobials doctors are prescribing. Obviously, there should be a stewardship program. Steward means, jano, jahaje hocche ki steward usually thake. What are the meaning of steward? জাহাজে থাকে যে স্টুয়ার্ড তার কাজ কি ক্যাপ্টেনের থেকে অনেক তলায় but he is the responsible for the care of the passengers. Okay, so there should be a stewardship program. That means one should be for from the diagnosis to the choice of drug, dose, duration and review. What is the aim? To know antibiotics up until it is needed. That means optimal indication. Okay, কাকে দেওয়া হচ্ছে, কি ড্রাগ দেওয়া হচ্ছে, কত ডোজ দেওয়া হচ্ছে, কত দিনের জন্য দেওয়া হচ্ছে এবং if there is any antimicrobial resistance is growing or not. Any steward in passenger also take care of you and monitors you what you need. Obviously that is why যদি ভালো কাজ করে আমরা টিপ দিই না রেস্টুরেন্টে, যে জাহাজে যদি স্টুয়ার্ড থাকে রেস্টুরেন্টে আমাদের যারা ফুড ডেলিভার করছে, যদি আগের থেকে তুমি টিপস দিয়ে দাও তাহলে তাড়াতাড়ি খাবার পাবে, আর যদি পরে হচ্ছে গিয়ে দাও তাহলে ততক্ষণে তো তোমাকে খাবারও দিয়ে দিয়েছে, তুমি জানো না তোমার খাবার কিভাবে হ্যান্ডেল করেছে। সেম থিং। সো নাও কামিং টু দ্য NAP AMR. Today we are discussing only 2017. Okay, I will share, please remind me here, I will share 2025 PDF with you. Okay, please, it will take only 1 hour and a half to read the entire document. Tomorrow I expect from every one of you, okay, that what are the newer things has been added to 2017 program. Okay, in your part only 2017 has been given. Okay, they have written on 2017, but you are giving exam on 2026 and in the ensuing year 2025 program already came, not program, plan already came. So it is very important. And obviously it's very important for your upcoming MCQ exams. This program will run until 2029. Okay, so 2029 e most probably তোমরা NEET-PG দিচ্ছ, তাই তো? তাহলে প্লিজ এটা একটু দেখে নাও, এখন আইডিয়া তৈরি করে নাও, পরে হচ্ছে গিয়ে লাস্ট মিনিটে যাতে এটা এই একটা টপিক পড়ে যাতে সময় নষ্ট না করতে হয়। ওকে, this is my suggestion. Obviously tomorrow I will ask what are the newer things. Okay, so for the core, what are the core areas of the national action plan? That means first creating awareness, surveillance, infection prevention, optimized antimicrobial use, research and innovation and intersectoral collaborations. Okay, What are the role of health workers? Do maintain the guidelines. That means there are guidelines for empirical and antibiotic use. What are the indications? Follow by this. Explain the prescription. I mean, if we given a prescription to a rural person who doesn't know English, that okay, 1 tab BD AC into 5 days. They do not know the meaning. Sometimes in the medicine shops, the pharmacist will tell you, okay, 5 days. No, please take it for 3 days and 2 drugs. Obviously, but then he will sell more drug. Okay. Right now, 1 tab BDAC 5 days, that means 10. 2 tab BD into 3. How many? Duto kore, that means 12. So, in patient, he will say, okay, doctor have told you much more longer. He is a money monger. Okay. Oh, yeah, I also read pharmacology, and if I am telling you, if you get only 3 days, 2 drugs, you will be better. Patient thinks, okay, doctor said 5, 3, the drug is much costlier, so it will take me less amount, less money. But what is happening? He is taking much more, he is overdosing, and also for lesser duration. So, there will be chances of AMR much more. These are the practical things that happens, okay. And what to not treat? Only we should not treat viral cold, first thing, okay. Do not use the leftover drugs, and obviously follow the IPC drugs should not be used if not indicated. Now this is a case, a 22-year-old man has fever, sore throat, cough and running nose for 2 days. There is no history of breathlessness, no danger sign. He is asking for strong antibiotics because he has an exam soon. 22-year-old, that means you guys, probably. Either older or younger, or in average is 22. You have fever, sore throat, cough and running nose. কি হিস্ট্রি প্রথমে নিতে হবে? What are the reasons? চলো, ঘুম পাচ্ছে? সকাল 9টার সময়, সকালে ক্লাস হয়ে গেছে বলো, সরি, চেষ্টা করবো পরের থেকে আর একটু পরে আসতে। চলো, কি জিজ্ঞেস করবো স্যার? আর কি হতে পারে? আমাকে তো বাদ দিতে হবে। It should be a TB case. It probably a viral cold. It probably a streptococcal infection. Sore throat is there. It probably a Klebsiella infection. So what history we should take about? ফার্স্ট এই মেডিকেশন নিয়েছে কি নেয়নি, এটা কেমন? তুমি নর্মাল হিস্ট্রি কি নেবে? বাকিগুলো তো জানো সিমটম আর কি হতে পারে, কি এক্সামিনেশন করবে। যদি সোর থ্রোট থাকে, শুড উই চেক ফর টনসিলাইটিস? লিম্ফ নোড সোয়েলিং, টনসিলটা কি লিম্ফ নোড না? সার্ভাইকাল লিম্ফ নোডের জন্য আরো অনেক থাকতে হবে, অনেক দূর। দ্যাট ইজ ইনফেকশন ওইদিকে ট্রাভেল নাও করতে পারে। লিম্ফ, তোমার টনসিলটা যদি ফোলে, টনসিলটা কি লিম্ফ নোড নাকি? হ্যাঁ, তাই তো। আর যদি টিবির জন্য কি দেখবো? কোনো কার্ডিনাল সাইন একটাও আছে কিনা? ভাইরাল না ব্যাকটেরিয়াল, সেটা এক্সক্লুড করার জন্য কি করব? ঠিক আছে, সামওয়াট কারেক্ট। না না না, অত দূর যাওয়ার দরকার নেই। এফএনএসি অনেক পরে, অনেক অ্যান্টিমাইক্রোবিয়াল কাজ না করলে তখন এফএনএসি। And what is the treatment? Obviously first symptomatic, then given some, if the first যেটা তোমাদেরকে জিজ্ঞেস করতে হবে, is this a continuous episode? If you are getting this multiple times in a year, if that is the case, the patient is probably immunodeficient, তাই তো? And if there is immunodeficiency, there is a chance of 22 বছরে HIV out, right? Probably there are some causes of immunodeficiency. Okay. So antibiotic indicated? No. What are the danger signs would change your decision? কখন আমি চেঞ্জ করব যে হ্যাঁ অ্যান্টিবায়োটিক দিতে হবে?